because feeling ready will never happen. So common misconceptions I want to get out of the way here before we jump into the content is coaching isn't allowed. I need a special coaching certificate or a new degree that also happens to come with a very high price tag. And there aren't any coaching jobs. And I saw some of these concerns kind of strewn throughout. So I'll share kind of my thoughts and ideas on those. So coaching isn't allowed. Coaching is a delivery method. It's not a separate discipline. Yes, there are skills to coaching, to being effective within this discipline, but it's not saying that you need a whole other degree or certificate to get that. BCBAs can ethically coach as long as you're working within your competence, both in coaching and in your specialty. You're using clear agreements that tell people what you are doing in coaching and what you're not doing in coaching so that you aren't misrepresenting services. So there needs to be a clear distinction between treatment, which is where we're comfortable, where we've worked, where we have funding, and coaching, which is education, not treatment. And so we'll talk more about that, but it is allowed as long as you are doing your part and being very clear about what service you offer. Next here is I need a special coaching certificate or a new degree. I've got a little bit of a soapbox on this and I won't share my whole spiel, but certificates can be helpful, but they're not required to start coaching. And again, I don't want to sound flippant about it, but I'm trying to move away from any of these constraints that we have and move toward expansion. Your behavior science foundation is very strong. If you're here and you have experience, if you've worked in the field, you have a strong foundation. And what matters most is the competence and direction that you need in the area you want to coach in. And so if you want to work with parents and you're coaching parents on challenging behaviors, they don't have to be, parents of children with autism. They don't have to experience the same exact problem you've worked with in the past, but you're using the science in that capacity. Do you have the experience? Have you demonstrated results? Do the strategies you use work? Are they grounded in science, right? That is a competency. And our goal now is to expand that competency to serve other people in a way that is more scalable than our current jobs. There aren't any coaching jobs. Yes, you're right. There's not going to be a job where you search BCBA coach and see a ton of positions with the same salary you earn today. However, if we are lifelong learners and we believe that behaviors can be shaped and skills can be developed, then we can learn the marketing and sales strategies to engage in different coaching and consulting opportunities and find and attract clients. This is a skill set we teach inside of our program, and it's something that differentiates those that have tried it and they've posted, hey, I opened up blah, 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 behavioral consulting. If I ask you all in the chat, and I'm actually not going to do this rhetorically, I'm very curious about this. So if I ask you in the chat, what does a behavior consultant solve? Like, what do they do? Tell me what your first thought is. Fill a gap, unmet goals, consult behavior. Christian, I love that. A behavior consultant consults behaviors. They sure do. And that's the challenge, right? That generic marketing will not get you clients. And so when you see people go out and say, I opened up my new company, blah, 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 behavior consulting, I think that's great if it also is paired with the specific problems that person solves. What are they actually consulting on? What support are they providing? Is it for kids? Is it for businesses? Is it for parents, right? And so understanding what we're going to support within our coaching practice and making sure that we have the competence to do so. So what is coaching? Again, it's a delivery, not a discipline. So we'll kind of walk through how to think about it. So coaching is how expertise is transferred, not how services are delivered. And so you have some of this behavior change expertise and say now you want to move into parent coaching. Your goal now is to create a coaching program that is structured and goal-oriented support. So not just sit and talk to your client and let them kind of rule the roost and say whatever they want and do whatever they want. You have a structure, you have a plan, you have a framework. It's delivered through education, reflection, and feedback. So it is a collaborative process with structure. It's focused on skills, strategies, and decision making. So again, it's not treatment or therapy. It is designed to develop skills, to engage in certain strategies, and to make decisions that move that person forward in whatever area or expertise you're coaching on. And if I haven't made it clear already, it's not diagnosis, therapy, or treatment. And so parent coaching, for example, is not an extension of your ABA therapy treatment in this context. It is using your science that you have learned, the strategies that you've tried, the results that you've seen, and now applying it to a broader audience and using it to educate and support. Some benefits of coaching is you're using the existing science, so you're just delivering it differently. And that's really important to understand, especially for those of you that might be experiencing imposter syndrome. It doesn't mean that you're necessarily ready for coaching, but it does mean that your science is incredibly powerful, especially in the coaching industry. This expands your professional impact, so you can move beyond those direct services and maybe move into an area that you are really passionate about, but there's not traditional funding for. Thinking leadership, OBM, supervision, consulting, parent training and support. And so this is going to help you then scale because you can design a framework that can be replicated and used across clients, teams, systems, because again, it's not treatment, it's education. And we want systems that work. And so that means that you design these systems to support whichever client or audience you are working with. And then this just adds to our career flexibility and fulfillment. So you saw all those comments in the Facebook groups. Maybe some of you are experiencing that. Maybe one of you posted that. And so because so many BCBAs are fleeing the field, if we can find opportunities to coach that allow for more strategic and meaningful work, then our field will just expand. And a lot of people think of our field only as the corner of the world where we serve the autism population. And I want you to think bigger. Like our field expands well beyond that. Just a moment here on science versus treatment. The science is the knowledge, principles, and methods for understanding and influencing behavior. And treatment is a structured, individualized service delivered to address a diagnosed need or a clinically significant problem. And so when you want to understand the distinction, just make sure that you're clearly in the camp of using the science within your coaching and not necessarily treating. That is a very important distinction. And of course, I've made it 5 times already, so I'll try to not make it again, but hopefully you understand that difference. So let's talk about coaching as dissemination. Dissemination means that we are making specialized knowledge usable. And right now, I would argue that in our field, we're not really making the science useful outside of just the autism space. It also means we're increasing access to effective strategies. Again, these strategies that are grounded in science, other people who don't have their BCBA are using them, sharing them, monetizing them, right? The book Atomic Habits is a book on behavior change. It is literally behavior analysis with the jargon removed. And that person is now teaching people how to develop habits using the science. Similarly, you can use the strategies and the science that you know to help impact a broader audience, solve bigger problems, and create that freedom for yourself. Dissemination is also supporting implementation in real world contexts, which again, it's not just one narrow context. It's any context where behavior change is what will help someone move forward, whether that's in health or in business or in personal development, right? Coaching is dissemination when it teaches applied frameworks. So again, when we're using that knowledge and science and strategy that we have and designing a framework that people can use to achieve results. When it supports behavior change through education, again, not through treatment, but in informing and strategy and execution. And it focuses on these generalizable skills. If I have to get incredibly detailed and narrow to solve your problem, then I might be venturing into treatment. And I might want to look at why these standard strategies are not working for you.